Okay, good morning. Come on, this is a church. Good morning. Okay, much better. Welcome to today's Community Forum. I'm pleased to see so many of you here today, and I'm sure that others will continue to come on. But again, thank you. My name is Russell Brooks, and I'm representing the Northern Virginia Democratic Black Caucus. The caucus is a coalition of the black caucuses representing Fairfax, Arlington, Prince William, and Loudoun counties. We're hosting this event, but first and foremost, I want to thank our co-hosts in this endeavor, the First Baptist Church of Vienna. The church has been extremely gracious in allowing us to work with them to put this event together. And so with that in mind, it is my pleasure to invite the pastor of the First Baptist, Dr. Vernon C. Walton, to come up and provide an opening prayer.
Good morning, everyone. Good morning. We are certainly grateful to God to welcome you into our sanctuary, to welcome you into our home. We're delighted that you are here. We're delighted to share in this opportunity with the Northern Virginia Democratic Black Caucus, and we are certainly looking forward to the information that is going to be shared. I want to also just thank in advance you for allowing us to share in this moment, and for all of the participants for being with us. We're living in some strange times. Amen. We're living in some strange times, and I firmly believe that our faith informs our politics, and I firmly believe that every good Christian is a voting Christian. And one of the things that is necessary in the times in which we live are people who can help us to interpret the times. And so we're here today to hear from you, to help us to interpret what is happening in the halls where policy decisions are being made. And so we look forward to this wonderful and rich conversation. Would you join me in a word of prayer? Gracious God, our Father, we thank you and give you thanks for this day, and we thank you for all of those who have gathered here. We thank you for this opportunity to be blessed by the fellowship and the company of those in which we share in this space. And we ask, God, your richest blessings upon us, that you would open our hearts and our minds, that we would hear, that we would be able to understand, that we would be able to digest, but more importantly, dear Master, that you would help us indeed to be the sons and daughters that you've called us to be, that we would use our voices, the movement of our legs, and that you would allow us to be able to help others to be blessed and enriched by this conversation and this time of sharing. Thank you indeed for all of those who have gathered. Thank you for those who serve. And thank you, dear Master, for all of the blessings that you have blessed us with. It is in the name of our Christ that we pray, and the people of God together say amen and amen.
Thank you, Pastor Walton. To provide an in-depth analysis of HR1, the so-called One Big Beautiful Bill, or some might say that ugly bill, that was signed into law this spring, we have the good fortune of being able to present an all-star panel for you this morning. We will hear from Delegate David Bulova, who represents this area and serves on a select House of Delegates committee assigned by Speaker Scott to examine the expected effects of federal job cuts and budget reductions. We also have with us Woodbridge District Supervisor Margaret Franklin from Prince William County. Supervisor Franklin was elected in 2019 and is leading the effort to create more affordable housing in Prince William County. Next joining us is Bobby Kogan, Senior Director at the Center for American Progress. Mr. Kogan is an expert on federal budget issues and the congressional budget reconciliation process. And finally, we have a member of the so-called Fifth Estate. Sam Shirazi is the host of Federal Fallout, a podcast and Substack devoted to Virginia politics. I welcome all of you. Here's today's format. Each of the panelists will deliver a presentation on a particular aspect relating to this bill, ranging from its genesis to the expected impacts on our lives here in Virginia. Once their presentations are complete, we have a couple of special video messages, and then I will ask the panel questions that we collected from you. The audience, I collected from the audience, and I will ask as many of your questions as time permits. I should also mention that we are privileged to have the presence of Senator Salim. And he will also get a chance to deliver a few remarks. So let's get started. Sam, will you provide the initial presentation?
Sure. Can you all hear me? All right, great. Thank you, Russell, for having us. Thank you, Pastor Walton. Beautiful church. I'm honored to be here. I will give more of the political background and a little bit of the sausage-making background in Congress. I think it's important to know that before we get into the policy details. It's obviously going to impact Virginia, and I focus on Virginia politics, but I follow this bill closely. And in any first year of a new president, they want to get something done. They want a bill, and obviously President Trump wanted to get this one done. I think it's interesting to think about what's in the bill given how he won in 2024. So first we look at 2024, then we think about 2025. 2024, President Trump did well with working class voters. He made gains with working class voters. And we can debate all the reasons for that, but the reality is people had been hit hard by inflation, and it had taken a toll on people's pocketbooks. And maybe they knew that President Trump, they didn't like some of the aspects about him, but they thought he would be better for my pocketbook. So I'm just going to go with him, and he won. So he gets into office, and let's just say President Trump is not always known for his attention to detail. So I don't think he was getting into office saying, I have this bill that I personally know all the details about everything in this bill. I think his strategy was, you got these Republicans in the Senate and House, we have the majority, let's get something done. I'm going to let them focus on passing whatever they want to pass, and I can take credit for it, and I got this big bill passed. And he is more on the political side. He is putting pressure on the Republicans to pass things. Obviously he's got his policy people in the White House and they're in touch with Capitol Hill, but a lot of this was through Capitol Hill. And there's a process called reconciliation. So under reconciliation, you can pass things in the House and the Senate with just a majority. There are a lot of procedural things I won't bore you with, but for most bills in the Senate, you need 60 votes to break a filibuster. And obviously the Democrats were not going to go along with almost anything in this bill. So there was no way this was going to be passed through the normal process. So there's this reconciliation process that was going to be happening in the House. And, the sausage making of it is interesting. I won't bore you with all the details, but big picture, I think what was surprising to me is this is essentially the same bill that former Speaker Paul Ryan would pass. There are a few things thrown in there for more working class voters. Now, we can debate whether those are actually, going to make any difference, whether they're just talking points. Frankly, they were relatively a small part of the bill. There were some things about tips and other things which, it really was not the focus of the bill. And so I think what was interesting is you had President Trump elected on the votes primarily of working class voters. Obviously, there were working class voters who voted for the Democrats as well, but there were a lot of working class voters who voted for President Trump. And he comes in, and the Republicans on Capitol Hill basically passed the same bill they would have passed 20 years ago. It's tax cuts for the rich, cuts to social welfare programs. And I will talk a little bit about that in a second, about why that is, but I think that was really an interesting part of this. And so you see this tension where there are more, I don't want to say moderate voting members, but let's say members who are in districts where they're worried about losing. And they were getting a little uncomfortable about this. That includes members of Congress from Virginia in the 2nd District and the 1st District. There was some pushback, theoretically, to some of these Medicaid cuts. But the way these things work is that the bill is written behind the scenes. They want to hit certain numbers for cuts, for tax cuts, for social safety net cuts. And once the bill's put together, there's just pressure to vote for it. You get President Trump calling people, you get him posting on social media, and I mean, I hate to say this, but this is the reality of how Capitol Hill works. The policy is almost, there isn't debate about this stuff. It's just vote for the bill or I'm going to primary you. I mean, that's the reality of how these things get passed. And it was a close vote in the House. It was a close vote in the Senate. I won't go into all the procedurals, ins and outs. I think a lot of those members felt uncomfortable voting for this. Some of them for pure political reasons because they thought they might lose. Some of them, I do think some of them have some heartburn about this, but they voted for it, so it is what it is. But I do think some of them felt uncomfortable with the scale of the cuts. But at the end of the day, they voted for it, and you'll hear about the policy aspect of it. But the reality is, despite all these working class voters giving President Trump their votes, objective analysis has said this will hurt the lower income folks, and it's going to help the higher income folks. And so it's a real kind of political mystery. Why did this happen? I think there's two answers, or I'll talk about two aspects of it. I think it presents the Democrats a political opportunity if they're able to use it. I think the Republicans have effectively communicated to people that these cuts are going to not affect you. It's the people who don't deserve it. It's the lazy people who aren't working. It's the undocumented people who don't deserve it. And frankly, these programs, you had to be legal to get them anyway, so it doesn't really make a whole lot of sense. But that's the message they're telling people. They're telling people, you'll be fine. It's these undeserving people who are going to get hurt. And I think it's important for Democrats to understand how effective that message is, because a lot of people believe it. I mean, you may not believe it, but that is how they get these things passed. I mean, and that is part of the mystery of all these working class people. For example, Southwest Virginia is probably going to get hit hardest in Virginia. One of the parts of Virginia that's going to get hit hardest by this. I mean, they voted overwhelmingly for President Trump. Their congressman voted for this bill. Why? I mean, I genuinely think a lot of these people don't think it's going to hurt them. And I hate to be this cynical about politics, but these government programs, I mean, they're complicated, and people don't always know they're on the government programs. I mean, they may think, yeah, I have health care. I work. I earned it. I have health care. Well, actually, you have Medicaid or you have Obamacare. That's, it's helping you get health care. But, they don't know that. And there was some news about 3 rural healthcare centers in the Shenandoah Valley that are going to close. I mean, those people voted overwhelmingly for President Trump. And so, they are already seeing the impacts of this. I think there is a political opportunity for Democrats to make the case to some of these voters, to win back some of those working class Trump voters, to say, look, you gave President Trump your vote, and he's not delivering for you. And, what our focus is to try to make sure people have health care, make sure they have food on the table, make sure their kids are educated, and focusing on some of those issues. I think there is an opportunity for Democrats to do well on this issue. Now, having said that, the cuts have been pushed into the future after the midterms for the most part, so the impact isn't felt. But obviously, we're already seeing these hospitals closing because they have to plan years in advance. And if they know in 2027 there's going to be a bunch of cuts, let's just close our hospital because we're not going to be making money in 2027. Democrats can start communicating that now, and they are communicating that. I think the challenge is just going to be trying to reach people and trying to break through the media ecosystem that these people receive, because the Republicans are not talking about this bill. They don't want people to know what's in the bill. President Trump, took a little bit of a victory lap, but he basically just forgot about the bill and has just moved on to whatever else he wants to do. He just wanted to get something done his first year. He got a bill. He can say he got a bill, so the Democrats can't say he didn't pass anything. But now the Democrats can point to what he's passed. And I think the thing that'll be interesting to see is how much are the Republicans going to be able to do the other shiny object. Don't focus on your hospital closing. Look at this crazy thing that some random person said. I was in Arlington. There was a random person who put something on a sign which was not appropriate. But that's all the Republicans want to talk about. They don't want to talk about a hospital closing. I mean, that is going to have much more of an impact on people's lives. Let's talk about the real impacts on people's lives from these policies that are coming out of D.C. Republicans don't want to talk about that. And I think we just have to keep in mind where people are getting their information, but make the case to people that the Democrats offer a different alternative to what is going on in D.C. and highlight some of the impacts about what's going on. So anyways, I try to focus on the political side of things. I think politics can be very disheartening sometimes when you see what's going on, but this is the process. And I think we have to do our best to just focus on the issues and make the case to people that, there's a different way of perhaps doing these things. So thank you.
Thank you, Sam. You've given us a lot to chew on, but now I want to turn to Bobby Kogan. Bobby, can you offer us some more detail on exactly what is in this bill?
Hi, everyone. Yeah, great, we're working. Hi, everyone. I'm Bobby. I'm going to talk about the bill, some of the stuff. I'm going to do a broad overview. I have like 10 minutes, so I'll do the best I can. I think my theme is, however angry you are about the bill, you are actually not angry enough. So I'm going to tell you a little bit about the things that are in it that folks should focus on. And I wish I had any good advice, but I don't. So we'll just can be angry together. So as Sam said, this is a transfer of wealth. This is actually, if you look at a single piece of legislation, there is no single piece of legislation in all of U.S. history that has done more to take from the poor and give to the rich in a single bill. There have been bills that have given to the rich. There have been bills that have taken to the poor. Normally, people are smart enough to do them different because it looks really bad, because it is really bad, if you say, oh, I'm going to take from people who are very needy and give to people who have a lot. But there has literally been no bill in U.S. history that has done more or has gotten close to doing this much. So I'm going to talk about some of that. So the largest cuts to Medicaid in U.S. history prior to this bill came from, you guessed it, Ronald Reagan. Of course it came from Ronald Reagan. These cuts to Medicaid are 3 times bigger, right? 4 times as large. I'm not talking about like, oh, well, these are just barely the biggest Medicaid cuts ever. These were by a mile the biggest Medicaid cuts ever. When we were coming in, we were like, worst case scenario, we were like, oh, maybe they'll do like, God, $300 billion. Maybe $500 billion in Medicaid cuts. They walked out of there with $900 billion of Medicaid cuts, nearly $1 trillion. 10 million people are going to be kicked off of their health insurance, right? And as Sam was saying, well, the Republicans will just say, oh, well, it's just fraud, right? Like no one, it's just fraud. It's just undocumented immigrants. Well, actually, they don't use the term undocumented immigrants, but anyway. It's not true, right? Like, there are huge cuts. So I'm going to talk about 2 of them, I guess. So the biggest one that folks, kind of the thing doing the biggest movement here is what they call work requirements, but are actually they're not actually requirements that you work. They're requirements that you tell the state that you are working or one of the accepted classes. Now, this is a fake problem, right? Like 92% of people who are in the category that they want working are already working. So it's true, there's 8% more that they theoretically want working, but the issue is by putting up these requirements, now all of a sudden you have tons and tons and tons of paperwork where the people who are supposed to be working and maybe even the people who aren't supposed to be working are getting kicked off, right? Because you have to submit all this stuff. Oh, you're a full-time caretaker? Well, if anything changes, you didn't submit it, boom, you lost your Medicaid. Oh, you actually are working, but you didn't submit the paperwork, or maybe you did, but we messed up, boom, you lost your Medicaid. So in Georgia, when they implemented work requirements, there was this guy, Luke Seaborn. He was someone who worked and was on Medicaid, and he thought everyone else was a moocher. He was in like 1 million ads for the governor. And when they implemented it, in the first 9 months that they implemented it, he lost his Medicaid twice, even though he had the same job the whole time. He is no longer supportive of Medicaid work requirements, to be very clear. But that's the issue, right? They say they were going after all the moochers, but instead they're just kicking off everyone who's doing everything right. You look at all the studies, work requirements do not actually cause more work. What they do is they cause people who are doing everything right to lose Medicaid. So a lot of the people who are losing their Medicaid are just people who are just trying to do everything right, and they're all of a sudden, they're having it ripped away. So that's one of the big cuts. Is about a third of the cuts come from this. Another big thing, right? So Virginia expanded Medicaid. You take Obamacare, probably the most significant, actually, this is pretty significant, most significant good piece of legislation this century. Expanded Medicaid, right? Gave health insurance to tons and tons and tons of people. Because of that, people in Virginia up to 100% of the poverty line can be on Medicaid. Well, this bill makes it so if you're above 100%, but below 138%, so you're on Medicaid, the state now must has mandatory cost sharing for you. So big co-pays, big premiums, whatever, stuff that makes it so now you have to pay to use your Medicaid. The whole point is it's a lifeline, right? They should be available for everyone. But now all of a sudden there are these mandatory things. Now every state's going to do it differently. We have a governor who might do pretty hefty bad ones. Maybe we'll get a different governor in the future who wouldn't do it. But it's up to 5% of your income. So imagine you make 20 grand. Now all of a sudden it costs you $1,000 to use your Medicaid. What person making $20,000 a year can afford to spend $1,000 just to use the health care? So that person didn't technically get kicked off of Medicaid. They're on Medicaid. They just literally can't afford to use their Medicaid, right? So now all of a sudden we are literally ripping away health care from some of the most vulnerable people in the entire country, or not technically ripping it away, but making it prohibitively expensive. That is what this bill did. At the same time, it's given enormous tax cuts to the rich. And when I say enormous, I mean if you take just the top 0.1% of America, right, the tippy top, there's more money from this bill flowing to the top 0.1% than the bottom half of America combined, right? Absolutely atrocious. Can you believe it? But they did it, right? End of material politics. Sam was like, oh, they did it anyway. God, they did do it anyway. Holy cow. So that's healthcare. I should talk a little bit about the rural hospitals. So one of the things that Republicans actually acknowledged was, hey, this might be bad for rural hospitals. And that might be bad for other people because even if you didn't lose your health insurance, if your hospital closes and no hospitals in the area, you have effectively lost your health insurance, even if you technically have insurance. So they said, all right, we'll give $50 billion of a one-time, slush fund to rural hospitals. Now, there are 3 problems with this. Number one, I guess it's like cool that you're helping hospitals or whatever, but really you should be helping people, right? Like you've now kicked a whole bunch of people off their Medicaid. These are the people who actually need help. That's the biggest problem with it. Number 2, they are helping rural hospitals, but they're doing nothing to help the urban or the suburban hospitals, right? There are actually people outside of Trump's voters who are going to be affected by this, and there's kind of no aid over there. But the third biggest thing is, so I said this was a $900 billion Medicaid cut. Well, it's a $50 billion fund for rural hospitals. This $900 billion goes on for forever. $50 billion is a one-time thing. The estimate is of that $900 billion, $150 billion is going to be taken out of rural hospitals. So you're already only a third of the way there. And again, it's one time versus forever. So you can see the problem, right? You don't have to be a rocket scientist to see the problem. So we're going to have a whole bunch of rural hospitals. As Sam said, some are already closing. If you are already struggling to make it by and you say, oh my God, we're going to be out a lot of money because the federal government is paying for your Medicaid or reimbursing the people, all of a sudden the people aren't going to go. That's less money into the state, into the hospital. Then they're going to close. So all of a sudden, a whole bunch of people are not technically losing their health insurance, but are losing access to it. It is of no use to have health insurance if you can't actually use your health insurance. Bad stuff. Now I'm going to get to something that makes me even angrier. I love health care. But I think there are 3 pillars of society. Well, I think there are more, but there are like 3 foundational pillars. We got a 3-legged stool right here. Probably better with 4. I should think of a better analogy. But 3-legged stool, you need housing, you need health care, and you need food. And I think the most important is food. Your mileage may vary. You might like any of the other ones better, and good for you. But it doesn't matter if you have shelter. It doesn't matter if you have health care if you literally cannot eat. That is the most basic fundamental thing. You have to have food. And I said it was the biggest Medicaid cuts in U.S. history. It was also the biggest food assistance cuts in U.S. history. Right? In the same bill that gave enormous tax cuts to the rich, they did the biggest Medicaid cuts in history and the biggest food assistance cuts in history. So our big food assistance program is SNAP, formerly called Food Stamps. It's a supplemental nutrition assistance program. It helps people literally afford groceries. And I'm just going to talk about one of the big cuts in there. It already has very evil work requirements on it. I cannot believe that they would say, well, if you're doing it wrong, then you're just going to go hungry. That is like unconscionable in the richest country in all of U.S. history. Sorry, not U.S. history, world history. Richest country in world history, you have people going hungry. And they said, you know what? You're not hungry enough. We should have you be hungrier. So there are already existing work requirements. They bump it up, so now all of a sudden that work requirement goes till you're 64. You can retire at 62. You can start collecting your Social Security at 62. But then they say you're a moocher, and then you lose your health. You lose your food assistance. They also, with some understanding that if you have a kid, like even if we don't like the adult, God forbid, if you have a kid, it's not fair to do something wrong by the kid. It's not fair to punish a kid no matter what you think of the adult. Well, they changed that. They said there used to be an exception if you had kids. Now it's if you have kids 13 or younger. So you're not working, or God, maybe you were working and you lose your job. Now all of a sudden there's less money for your 14-year-old. Your 14-year-old goes hungry because you lost your job in a recession. That's what this bill does. Now there's an exception. They say, well, if the economy's bad enough, then we're in good shape. We'll give you an exception. But this bad enough threshold that they created was an unemployment rate of 10%. Just to put perspective on that, in the Great Recession, 2007, 2008, 2009, everyone remembers how awful the job market was. People with master's degrees were begging to get retail jobs. It was an atrocious job market. And we hit 10% unemployment once for 1 month in that. So if you have Great Recession level economy and you lose your job, you are considered a moocher under this bill, and they take away your 14-year-old's food. Because we all know that 14-year-old boys don't eat a lot of food. That's this bill. I'm going to talk really fast about one more thing, and then I'm going to pass on because I'm sure I'm at time. They give $30 billion to ICE agents in this bill. When President Trump came into office, he increased ICE spending at the agent level, basically by about a third. And we have seen families ripped apart. People who came here just looking for a better life, who have maybe lived here since before they learned a language, deported, families ripped apart. That was what he was doing with a roughly 33% increase in what he was spending. $30 billion more means if you're ramping up, eventually you're getting to maybe tripling ICE funding at an agent level, right? There's also the air prisons and everything they're doing. But we're talking like boots on the ground, people ripping families apart. And I cannot actually put into words what we think that can, what that'll look like. Now I'm getting flustered. I'm not even talking well anymore, but it's because I'm so angry about it. Again, the theme was you're not angry enough. Right? A lot of these folks live in Virginia. A lot of these folks have lived here their whole lives, or maybe not technically their whole lives, but have lived here for all their lives they can remember. They are just like us, and they deserve to be here as much as any of us do. And there's a lot of money to help ruin their lives. So I wish I could end on good news. I would just say, everyone is going to be fighting as hard as they possibly can to undo as much of this as we can. It's an uphill battle, and elections really, 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 really matter. But the real thing that matters is the human impact. And that's the end of my talking.
But thank you, Bobby. On that depressing note, I think some of you may have some questions now that we have heard in detail about this bill. Before I move on to Supervisor Margaret Franklin, for those of you who would like to submit questions, raise your hands. And members of the Black Caucus are going to provide cards for you. Write down your questions, and we'll try to get them during the question and answer period. Okay. Now, I think we all want to hear how this bill is going to affect us directly on the local level. And to provide that information, we are privileged to have Supervisor Margaret Franklin with us, who will offer her perspective on what we should expect.
Well, good morning, and thank you all so much for being here, and thank you to Pastor Walton for opening up your church and for the Black Democratic Caucus for partnering on such an important topic. As mentioned, I do want to talk about specifically some statistics that are impacting Virginians as well as nationally, and the impact on state and local. And it was really a great segue into the impact on state and local particularly. First, I just want to start with the urgency, as mentioned. Northern Virginia economy is already under immense pressure. We've lost over 11,000 federal jobs. That's 11,000 federal jobs in the Commonwealth. The unemployment rate in Fairfax spiked nearly by 35%. And this is from a county that has historically been well off. So if you increase the employment rate by 35%, you can kind of get a sense of the impact on everyday Virginians. With regards to healthcare in our safety net programs, over 323,000 Virginians will likely lose Medicaid or ACA coverage, and that's probably on the more conservative end, right? 187,000 more could lose coverage, as mentioned, based on the new reporting requirements, and we'll talk a little bit more about that. With regards to SNAP, 470,000 Virginians have already been impacted by SNAP cuts, and that's with 42,000 children having been come out of poverty as a result of the benefits of SNAP. So that's your additional input, right? You have about 80,000 to 90,000 in tax breaks that's in this bill. So remember, we just talked about all the cuts that are going to be impacted by regular Virginians, but we have almost 100,000 in tax breaks for those over a certain who make over a certain amount. But then also, we talk about the impact of healthcare, food security, childcare. All of this will be impacted by the big ugly bill, right? And so how does this play along with our state and local? Well, number one, with all the cuts, we have to figure out what we're going to do with these individuals who have lost their coverage. What that means is our state and local budgets will be negatively impacted. And a lot of times, and I look forward to hearing from members of our General Assembly, a lot of those costs are eventually passed on to localities. Now, you know, a lot of the localities in Northern Virginia, you hear us talking about a lot of the commercial tax base that we're trying to bring in, and why are we going to certain industries? Well, you know, it's because of the uncertainty moving forward, right? So when these cuts are finally realized in totality, we're going to look at Loudoun, Prince William, Fairfax, and other parts of Northern Virginia, particularly generally wealthy areas that will lose a lot of that status. Oh, and by the way, a lot of these wealthy areas include our minority populations, right? We are working class individuals, highly educated, mostly minority. Prince William County particularly is a minority-majority county. We're the 10th most diverse, and we have thousands in double digits who have lost federal jobs. I know several of them personally. My constituents have called me asking about, well, what about jobs in the county? What about health insurance? What about impacts to other assistance programs? I'll just end with saying I recently hosted a town hall with Congressman Vindman with our senior citizen population. It wasn't on any particular topic, actually. It was generally just on what are your thoughts, what do you need help with? And the number one topic, as you all can imagine, was, well, what about Medicaid? What's going to happen with Medicaid? Because, you know, I've been receiving, you know, these type of benefits, and my grandson and my daughter. And what about Medicare, which we haven't talked about at all, but there's also going to be some impacts to Medicare, right? Because a lot of those individuals on Medicaid will eventually just continue to be without coverage, but thankfully, if you're over a certain age, you can qualify for Medicare, but what does that look like in the future? And so you have a lot of individuals who are nervous, who have been generally stable throughout their entire life, that live in our communities, who are now afraid that, well, they recently retired within the last 5 years. Well, maybe I should have stayed in the workforce. Well, but I was also working for the federal government, so maybe I would have lost my job anyway. And so we are facing some dire times, and I will tell you that the impact on state and locals is going to be, we're going to have to be a lot more conservative with our budget. I pray we don't have to do additional tax increases to pay for the additional supplements to take care of our residents who were pushed off of federal benefits, but also it's going to take a close relationship with our General Assembly to say, listen, we have to kind of share the burden of taking care of our residents that our federal government decided no longer mattered. So we have a lot of work to do, and I know that our General Assembly is thinking about these issues. I am confident we will have a governor with the last name Spanberger who is looking at these issues very carefully. She already has a plan in mind for how she plans to address a lot of these challenges. But don't forget about your state and locals, because we're the ones that's going to have to carry the burden to figure out how do we take care of these individuals where the federal government had a larger impact at some point. So thank you. There's more to come, and I look forward to having this be the start of the discussion. In a few months from now, we should do this again to talk about how the impacts are actually falling down, so that we can talk about solutions and what our residents actually need. So thank you.
Thank you, Supervisor. And to round out this very enlightening panel discussion, I want to ask Delegate Bulova to describe what he has learned from his assignment on the House of Delegates Emergency Committee on the impacts of federal workforce and funding reductions. Delegate Bulova is the chair of the committee. Sir, what do you expect to happen across the state?
Very good. Well, thank you very much. And this queued up very, very nicely. And again, really appreciate the opportunity to be here. Pastor Walton, thank you so much for hosting this event. Love being in this space with you. First of all, I do want to acknowledge right up front that this will impact very acutely many of my constituents. So the haphazard way that this has happened, the severe cuts that have already been talked about, this is going to affect real lives with respect to layoffs, with respect to cuts to core services. But what I've been asked to do is provide a little bit of a perspective with respect to the state in terms of what it's doing to our budget and what it's doing to our economy. And so I'm coming at it from that perspective. I do remember very, very clearly, it was in January, I was very innocently sitting at my desk, and I got a call from Speaker Scott. And of course, when Speaker Scott calls you, you go ahead and pick up. I immediately thought maybe I shouldn't have picked up this time because he started off with an apology. And he's like, I'm so sorry, David, for what I'm about to ask you to do. But even in January, Speaker Scott, I think, very astutely realized that Virginia was going to be faced with some real challenges with respect to what was going on at the federal level. And so he asked me to chair the emergency committee, and he wanted to make sure that it was, number one, bipartisan. So actually on the committee, there's 7 Democrats and 5 Republicans, so there's 12 members of us. And he especially wanted it to be data-driven, right? And so I think first and foremost, he wanted to make sure that we were presenting the facts as they were, and that there was no arguing with respect to the impacts on Virginia and its communities. In terms of his charge to us, it was threefold. So first, it was collect data on the scope of the workforce cuts. Number 2, analyze the impacts of these cuts to Virginia's economy and budget. And to me, the most important part was to invite stakeholders to present their views and for us to collect a wide range of views, not only with respect to understanding how these cuts impact them, but what are the solutions that Virginia can put into place in order to be able to protect Virginia and Virginians. In addition, he really wanted to make sure that we took the show on the road, right? And so I think one of his concerns, and this was raised earlier, he didn't want this to be seen as a Northern Virginia issue. He didn't want this to be seen as an urban issue. This is a Virginia issue that will affect every corner of the Commonwealth. And so we took that to heart. We started off in Alexandria. We're up in Alexandria at the Virginia Tech Innovation Center, where we talked about the impacts to the Northern Virginia region. We also dove into the impacts on higher education, given that we've got George Mason universities and a couple other flagship universities up here. Then we traveled about 5 hours down I-81 to the city of Wytheville. And at Wytheville, we focused on the impacts on agriculture. So remember, agriculture and forestry are still Virginia's largest industries. And so the tariffs in particular have a big impact with respect to agriculture, and then we dove into the impacts on healthcare. From there, we went across the state again to Norfolk State University, so behold the green and the gold. And so there we learned about the impacts on the Hampton Roads region, Port of Virginia, talked about tariffs more, but I think the real impactful part of this was to have school superintendents from the region come in and tell us how these things were going to impact their teachers and their students. And that's really critical because these are things that have reverberating effects over the generations as they're struggling to be able to teach their kids. One of the greatest challenges we had was that this is all occurring in real time. And so it was really good that we got ahead of the curve on this, but as we were collecting information, we were doing that as the debate at the federal level and the cuts at the federal level were still unfolding. And so that was a challenge. What I will tell you, though, is that while there still remains some uncertainty, right? And so a lot of the policies that were put in place, the federal agencies need to develop regulations, they need to develop rules, they need to do guidance. With the passage of the reconciliation bill, those impacts are coming into much clearer focus, and we have a very keen understanding as elected officials what this is going to mean for us in 2026 and beyond. We did present our final report this last Thursday down in Richmond. It was a joint meeting of the Emergency Committee and the House Appropriations Committee. And so what I wanted to do is just provide a bit of an overview of, or a summary of what was contained in that report that I think will be helpful for our conversation. So a couple of quick facts as far as why this is so important to Virginia. So number one, 24% of Virginia's budget is driven by federal spending. Okay, so when I'm looking as an appropriator at all the money that we have to spend, 24% of that is coming from the federal government. You have parts of it that are particularly vulnerable, and those are Health and Human Services and Veterans Affairs. About 9% of local funding comes from the federal government. That shifts a little bit, but it's a pretty big amount with respect to what Supervisor Franklin would have to directly deal with in terms of cuts. We have the second largest federal workforce in the nation except for California, and the only reason that California has more is because they are so big. But about 11% of our workers are federal workers. $109 billion is spent by the federal government each year in federal contracts. That's something to also take into account, that these aren't just direct federal workers. These are people who rely on federal contracts for their employment. And then finally, $52.3 billion in direct support to Virginians, and that was in 2024. So the bottom line to remember is that about a quarter of Virginia's economy is driven by federal spending. That is massive. Just wanted to build on some of the items that were talked about in terms of unemployment. So Weldon Cooper Center out of the University of Virginia. They are great at tracking data and doing analytics. So about 11,000 federal jobs have already been lost in Virginia. They also predict, based on what they've seen in terms of what's announced or being proposed, that we have an additional 10,500 jobs that are at risk of losing employment. So we're only about halfway there, folks, in terms of what the impacts could be. We started off with a statewide unemployment rate of 3% in January. That jumped to 3.6% in July. Weldon Cooper Center anticipates that'll go up to at least 4.2% from what they're seeing at this particular part. I did want to highlight some of the significant impacts from the state perspective, and some of these categories have already been covered. For SNAP, with the impacts for Virginia particularly. So one of the two of the key areas are a new matching requirement for Virginia based on our error rate. And so what this does is says, hey, Virginia, if or any state, if your error rate is above a certain percent, you have to pay matching funds. So our error rate now is at 11.5%. What that means is starting in fiscal year 2028, we would be paying $270 million more just from Virginia's budget in order to be able to support that program. This is very complicated. It's not that we haven't tried to fix that error rate. We would love to be able to get that down. It's just that we're relying on over 100 local community service boards to be able to implement that. And so we're going to do our best to try to bring that down. But if we don't, we are going to be looking at $270 million more dollars bottom line for the state. One that's absolutely unavoidable, and this was a direct shift in cost responsibility, is that the federal government changed the formula for administration of the program. And so it used to be a 50-50 cost share. Now it's 75% state, 25% federal. That means an unavoidable cost, something that we can't get out of $90 million per year. So that's an opportunity cost that we've lost. We're now going to be paying $90 million per year where we didn't before. One that kind of flew under the radar that I am also really concerned about is that the bill prohibits the FDA from increasing the cost of the Thrifty Food Plan. And so the Thrifty Food Plan is the cost for a family on a thrifty budget to have a nutritious meal. And that is what the SNAP benefit, the maximum SNAP benefit, is based off of. By freezing that, and with inflation rates as they are, you're basically choking that program. And so as inflation goes up and that cost can't, families are going to have to make up that difference, which is going to have a real impact. Medicaid, we went ahead and talked about the impacts of the work requirement and redetermination. A lot of those administrative costs are going to be covered by the federal government, or they're going to be covered elsewhere. I think the real key takeaway for this one, for the Government Accountability Office estimates, or has done estimates for some states in terms of the administrative costs of applying for that. For Kentucky, which is smaller than Virginia but kind of similar, $221 million to be able to do that. And so that's $221 million now that it's going to go towards bureaucracy rather than actually serving people. For the hospitals, we talked about the hospitals and the hospital provider tax that we put into place. This is what allowed us to expand Medicaid. It is also what allows us to provide higher reimbursement rates. Key takeaway from that one, and this is from the Virginia Hospital and Healthcare Association, is that they expect when this is fully rolled out a revenue loss of $2.1 billion. And I think it was already mentioned, you're already starting to see hospital systems anticipate those cuts with the 3 hospitals and clinics out there in Augusta County already announcing that they're going to be closing down. The other one that I wanted to end on in terms of the big impact, and this is what the Reconciliation Act did not do but should have done, and that is dealing with the premium tax credit for health insurance. And so this is what we had done in terms of the health exchange in order to be able to lower the costs of premiums. And the idea is you need to incentivize people, especially healthy people, to get that health insurance. Otherwise, the premiums for everybody else go up. And so it helps all of us to get these people insured. What's really wonderful, at least it was, is that this program has worked. And so in all the years that we have tracked how many unemployed or uninsured people we have in Virginia, we are now at that lowest level at only 7.6% of non-elderly adults. And that's a huge achievement that we worked really, really hard on. But because the federal government, because Congress didn't extend that, that means that immediately coming this next December, that those rates and those premiums are going to go up. And so just to kind of give a key indication, a family that is making 200% of the poverty level, $48,000 per year, is now going to pay, they used to be paying $126, now they're going to pay $308. So more than a doubling, about 2.5 times more. If Virginia picks the cost up to do that, and I'm kind of hoping that we do, if we have the bandwidth, $250 million more dollars that's going to come out of our budget. I do also want to say that it's not just the reconciliation bill. I know that we're focusing in on that particular bill. It is amazing to me all the different ways that the federal government, the president, Congress have tried to figure out how to sneak in cuts to different programs. And so there are literally executive orders, layoffs, guidance, pauses, rescissions, cancellations, and now we've got the fiscal year 2026 Appropriations Act. 2 examples that I just wanted to highlight. And so we had a program called the Building Resilience Infrastructure Communities Grants. Just recently, $36 million of those grants were canceled. A good part of that would have gone to the city of Richmond to upgrade their failing water treatment system, so things as fundamental as clean water. Another example is the city of Hampton had been awarded $20 million to support investments in historic Aberdeen Garden District. If you're not familiar with the Aberdeen Garden District, this was designed and built by African Americans under the New Deal in 1935, and this was part of resilience and environmental justice programs. Last June, that $20 million was canceled, leaving that community in bad shape. So I wanted to end on sort of a positive note, because we did, as far as engaging stakeholders, say, hey, what do you want your General Assembly, what do you want local governments to do? What would be beneficial to help Virginians and our economy? And so we did collect up what I think is a really good menu of options that us as a caucus, as Democrats, I think we're going to be looking at, can we implement these in the 2026 session and beyond? One category was housing. A big area that was a focus was allowing for laid-off federal workers to end leases. And so this is particularly important for especially younger workers who haven't worked there very long, get their first job, really proud of that. They enter a rental agreement, and then they have their income cut out from under them. And so we want to make sure that they're able to break that lease and not get underwater and face eviction. Another one is increasing funding for the Virginia Eviction Reduction Program. This is a program that we put in as a result of COVID. Really great program. We're funding it for $3.5 million. Here's the thing that I just discovered, though, is that none of that money goes to Northern Virginia. And so that seems to be a real obvious place, is that we're going to be impacted hardest by these federal layoffs. We need to fight really hard as Northern Virginia Democrats to ensure some of that money comes up here. Unemployment benefits is another area that we've really focused on. We have one of the most stingy unemployment benefits across the nation. Some of the ideas we have out there is making sure that everybody is eligible for 26 weeks of unemployment. It can be as low as 12 weeks, and when you have a high unemployment economy, that is just not enough time for somebody to be able to find employment. We also have one of the lowest weekly unemployment rates. We did increase that this last year thanks to Delegate Martinez, a Democrat from Leesburg, really proud to do that, to increase it to $430 per week. To put that in context, if you annualize it, that is an annual salary of $22,000. Nobody in Northern Virginia can live as an individual or support a family to be able to do that. We actually put on the governor's desk a bill to increase it by twice that much. He went ahead and said nope. He was going to go ahead and put that in half. So that's something we can do. And then finally, on workforce and economic development, couple of ideas: incentives for workers to stay in Virginia. And you're thinking, well, of course, why would anybody want to leave beautiful Northern Virginia? Well, the problem is that a lot of these federal workers, they're well paid, they're highly skilled, and they're mobile. And it was really jarring to me the last time I was down at Union Station. They already have kiosks saying, hey, New York City will take you. And so what we want to avoid is a brain drain of Northern Virginia's exiting other places. And so this is a way to try to keep people here locally. And then the flip side of that is tax credits to employers to hire former federal workers. And we already do things like that for the Department of Veterans Services in order to be, and this is particularly important because federal resumes aren't necessarily going to easily translate into the private sector. And you want to give an incentive for employers to take a risk. And there's a number of other things that we can do with respect to economic development. We do need to use this as an opportunity to diversify our economy because this is a game changer in terms of the federal government. One of the items that I am excited about, and we've already gotten started rolling on this, is what do we do with all the shuttered office space that kind of litters Northern Virginia and other areas. And so Fairfax, Arlington, Alexandria, Prince William, Virginia's First Cities, which represents a lot of our older cities, have proposed something to do a public-private partnership to help convert that land, so clear that land, consolidate that land, so that it's really ripe for private development. And it's a really cool way of doing a partnership, particularly with respect to dealing with our affordable housing crisis. I was actually really pleased to get through budget amendment this last year to be able to start that. Got vetoed by the governor, so we're going to give it another try next year. So with that, we do not operate in a vacuum. I want to make that really, really clear. So we do have other challenges that are coming up with the budget next cycle, and I know Supervisor Franklin understands how this works. Just to put it into context, in order to be able to do mandatory increases in Medicaid to keep up with population demands, in order to re-benchmark for K through 12 education, that's going to cost us $1.7 billion. And then there's the opportunity cost, right? Because as a Democrat, I very much believe in raising the minimum wage. I think we ought to have paid family and medical leave. Those are priorities that we've been working on for years. And what's happening at the federal level impacts our ability to be able to implement those things on the real ground. But I guess what I can say is that while we have a lot of challenges ahead, I think you've got a Democratic General Assembly that is very, very committed to making sure that we do buy right for Virginians in the future. So thank you very much for having me today.
Thank you, Delegate Bulova. I also want to acknowledge the fact that we have the state senator from this area in the room with us, and I want to give him the opportunity to offer us a few words. Saddam, Salim.
Good morning, everyone, or possibly good afternoon. But I really want to first say thank you to the panel and thank you to the church for hosting, as well as the Virginia Black Caucus for doing this. As somebody who's been elected for about 2 years, some of the fundamental things that the panel discussed and are going to discuss resonated with me is the fact that I think Bobby mentioned you've got to provide people with housing, health care, and food. And many of you know that's how I ended up here, from natural disaster to getting affordable housing and all of that. So it is very difficult, is what I learned in the last 2 years. What Delegate Bulova is talking about when it comes to the budget is that we're not in a vacuum. We know we have to do 100 things, and we have to pick and choose which ones we do. As a result of that, you will notice, including the supervisor up here, we become sort of away from the public, away from a lot of things, because we want to make sure we fight for those issues, yet we simply don't have the fundings to do it. So, I'm not going to go too detailed into HR1, but I will say, when your government tries to take away your access, your fundamental rights to certain things, we have to look at it from the point of view of what does that really send, what kind of message does that really send? And whenever I do any of these speaking engagements or talks, I tell people this. Back in 2008, prior to Obama getting elected, my parents had to go to a local clinic. They paid $10, and they could only see the doctor every 6 months. From that, my mom realized she had to get a major surgery. My dad realized he was diabetic. You fast forward 2008, Obama gets elected. This is great. We're looking forward. His policies allowed my family to get health care. The reason I tell this to people is that that is what the government is supposed to be doing. They're supposed to come in to make sure that your days are better than it was yesterday, and that the policies they put in are better for your children and your grandchildren. This administration has come in, and again, this is where the anger comes in a little, and they have done the opposite. They have said, your life may be better today. What do we do to make sure it's the other way, that it gets worse as it goes forward? And that's why we're seeing a lot of the rural hospitals. I know we're talking about all of that, and a lot of folks come up to me and say it's not going to be impacted until 2026, 2027. But a lot of people are going to have to plan. Do I go get my medication, or do I pay rent? Do I get that surgery that I desperately need, or do I just wait it out, 70 or whatever age, and just go in that direction? Those are the things that some of us up here see every single day. And one of the biggest challenge that I face as an immigrant, as a person of color, and I think many of the electeds will, including I see Delegate Karen Keys-Gamarra up there, is that we get reached out about the number one issue, which is the ICE issue, that the federal government, including in HR1, where they have fundamentally created a state police that is under the direction of our president right now. It is scary for black and brown communities, and I think you all saw the Supreme Court decision as well, where they can use race, essentially just pull out a card to showcase what shade are you today. Depending on that shade, you will get arrested or you will get questioned. I have had close relatives and family members who have been picked up in the middle of DC They're still in Farmville, Virginia, and there's nothing I can do. All I can do is call my elected officials at the federal level and try to get some reassurance to the families that they're not going to get deported to a third world country. Those are the things that a lot of us on the state side that we deal with outside of what HR1 has been doing. They're institutionalizing the idea that conservative values means you're no longer welcome in America. Back in the early 2000s, had my father known what was happening right now today, and I asked him this question last week, would he have made a different choice? And he said, absolutely. And he said, I tell other people, this is not a country, we're at a point where this nation has to determine, do we move forward with the fundamentals of this administration, or do we continue in the idea that we welcome every single person that needs our help, that needs protection from political issues overseas. Those are the things that this nation has stood for, is that the American dream is no longer the American dream. And the things, we're going to be seeing in the 2026 session is that it's going to be difficult, not only for the budget, but to get a lot of our things done, unless we get, this always happens every 4 to 8 years. We get Republicans who are in charge, they'll do all these terrible things, and then everyone's like, Democrats are going to come save us, and somehow we still have to be the nice guys. We do the right things, we put in policies in place, and then 4 to 6 years later, another administration will come out and say, look, we're going to dismantle every single thing that the last people have done. So as you listen to these folks up here, as you listen to the panels and some of the folks up here, I want you to remember this. This administration is doing things as if they're not leaving at all. And they're setting this sort of idea in your mind that they can get away with everything, from renaming the Department of Defense to the Department of War, which they need congressional approval, and so many other things. And the things that majority of minorities and people of color have benefited from are being taken away. So I want you to really pay attention to that and understand that it was never about, getting conservatives elected on their end. It was always about dismantling the institution that has always provided for those who never had a shot to be at the table or fight on their own. So thank you for being here. Thank you to the panel, and I will now go ahead and turn it back.
Thank you very much, Senator. Now we're going to have an opportunity to hear from two of the federal representatives for the Commonwealth. First, we'll have Representative Jennifer McClellan, who unfortunately couldn't be with us here today, but she was able to provide some remarks on video. Please play them. Audio. Stand by while they fix that.
We've been here before. And Dr. Martin Luther King Jr.
Can I make a suggestion?
reminded us that we have
System, AV people, please start it from the beginning. Thank you.
Hello, Congresswoman Jennifer McClellan here. I'm sorry I can't be with you in person, but I want to thank the Northern Virginia Black Democratic Caucus for allowing me to participate virtually in this important conversation. First, I want to acknowledge the moment we are in. Political violence has reared its ugly head in America yet again. As a result, we again see anger, fear, hatred, and division across the nation. But we've been here before. And Dr. Martin Luther King Jr. reminded us that we have a choice to make on where we go from here, chaos or community. We have a choice to focus on love or on hatred. And like Dr. King, I choose love because hate is too great a burden to bear. And as Senator Robert F. Kennedy emphasized the night Dr. King died, what we need in America is not division, hatred, violence, and lawlessness, but love, wisdom, and compassion. That's hard to accomplish in the face of so much hatred and bigotry right now, but it is necessary if we're going to survive as a country long term. And you have the power to decide whether next year we celebrate the 250th anniversary of the revolutionary idea that the power of government derives from the people, or whether we're going to mourn the loss of that idea. You have the power to decide whether government will strive to make the ideals upon which this country was founded true for everyone or not. Because a government by, of, and for the people only reflects the perspective and therefore meets the needs of the people who participate. And that means voting. And we are blessed or cursed, depending on your point of view, with the opportunity to vote every single year in Virginia. And every election matters. The 2025 elections will determine whether we have a governor, lieutenant governor, attorney general, and House of Delegates that fights for access to affordable health care, a good education for every child, meeting our energy needs affordably and reliably without destroying our planet in the process, and more. And next year determines whether we have a Congress that actually serves as a check on the Trump administration and his harmful policies or not. In the meantime, House and Senate Democrats have put forward legislation to reverse the Medicaid and SNAP cuts in the big ugly law that you heard about today. We are fighting for funding bills that improve the health, safety, and economic well-being of every American. But we cannot overcome math. And President Trump and congressional Republicans are more content to rip health care from millions of Americans and gut the progress made on everything from clean energy to affordable housing and more. We keep hearing that they want to do additional reconciliation and rescission bills, but we have no specific yet. Current government funding expires at midnight on October 1st, less than 20 days from now. And we face the no-win situation of voting for funding bills that do more harm and allow the Trump administration to ignore Congress and do whatever they want, or a government shutdown that harms Virginia and Virginians and gives the Trump administration the flexibility to do whatever they want by keeping the government shut down for as long as he wants. It's a no-win situation, but we're going to do what we think is best for the majority of Virginians. So what can you do? 1, you can vote in every single election. 2, organize to ensure we elect Abigail Spanberger, Ghazala Hashmi, Jay Jones, and expand the House Democratic majority. 3, you can amplify the voice and the work of the Virginia Democratic delegation in Congress so that more people know that we are fighting attacks on our progress while trying to help people and solve problems. Call your representatives at every level of government to tell them your perspective on the issues we face, even if you think they're going to vote the way you want them to. Tell your stories about how these policies impact your day-to-day lives. Organize to make sure we take back the House and the Senate next year. And rest when you need to, because rebuilding our country in a way that lives up to the ideals upon which it was founded and leaves no community behind will not happen overnight. And it's an all hands on deck moment. But this is the long haul. So if you need to put down your phone, touch grass, or put your own mask on first, do it. Because we need you if we're going to make it through these difficult times. Thank you for being here today and everything that you've already done, and have a blessed day.
Finally, Senator Mark Warner also wanted to address this audience. And he took time to record some remarks, which we will now play for you.
Senator Mark Warner here. And first, I'd like to offer greetings to my good friend, Dr. Vernon Walton, pastor at First Vienna, and to the whole First Vienna Baptist family. Thank you for being so involved in the community in so many ways. I also want to give a great thanks to all of you who were willing to turn out this week for our friend James Walkinshaw, who is now a new member of Congress, representing Fairfax County and being able to add one more vote in the United States House. Now that we move past James' race, we can focus on the critical next thing that's up, which is our state elections. We've got every member of the House of Delegates up, but most importantly, we've got our governor, lieutenant governor, and attorney general. And I'm asking you, please get out for Abigail Spanberger, Ghazala Hashmi, and Jay Jones. And let me say an extra word about my dear friend Jay Jones. I had a Republican attorney general when I was governor. And at least at that point, there was a Department of Justice that still was about justice. If we don't elect Jay to be the attorney general, the current incumbent will be filing lawsuits against a Governor Spanberger every day of the week. And with this Trump administration, where the Department of Justice is about everything except justice, it will be an extra burden on the next governor. So let's get out for the whole ticket, but let's really go the extra mile for Jay Jones. I also want to take a moment, and as we get past the fall, we move into 2026, and finally being able to directly go against the excesses and horrible operations of this Trump administration. I'm going to take a minute and talk about the big ugly bill that became law this past summer without a single Democratic vote. I've been governor-centered. I've seen a lot of ugly legislation. There may be no bill, no law that is more cruel, that is more inhuman, that has less empathy than this big ugly bill. It cuts SNAP benefits to literally millions of Americans and a couple 100,000 Virginians. What does that mean? It means that school breakfasts, school lunches, support for our food banks will be cut dramatically. We still have way too many Virginians that are already food insecure, and these cuts to SNAP will make matters much worse. But the big enchilada in terms of the awfulness of this bill is what it does to health care. Cuts health care for close to 17 million Americans. 11 or 12 million Americans in terms of Medicaid cuts. Another 4 or 5 million Americans if the Obama tax credits that expire at the end of the year are allowed to expire. And why all these cuts to health care? Well, to pay for tax cuts for the wealthiest Americans. That's not fair. It's not right. In my mind, it's downright un-American. What this will do in terms of Virginia, where we're late at expanding Medicaid, we'll go back to pre-Obamacare days in terms of the number of uninsured. So even if you're in the audience and say, well, look, thank goodness, I got health insurance, so I won't get hit. Well, no, you put hundreds of thousands of Virginians showing up back at the emergency room door, and that's going to drive up rates for all of us. So we've got to say no to these Medicaid cuts that hurt the most vulnerable. We've got to say yes to expanding the Obamacare tax credits, where people will already in Virginia in October start getting bills that if they buy their health insurance through the Obamacare marketplace, you'll see your rates go up 20, 30%. For an average family in Fairfax County, it's maybe making $80,000, $90,000 a year with 4 folks in the family. Those rates will go up $1,000 a month because of this awful bill. And don't take my word for it that this is going to happen. I was down in Southeast Virginia a couple weeks ago in Franklin, the city of Franklin, where the hospital there, the rural hospital, will close. We've already seen rural hospitals lose their ability to deliver OBGYN services, delivering babies. We heard just this week, and again, I give courage to these doctor practices in Augusta County, which is west of Charlottesville. 3 of those rural doctor practices are closing now because of the effects of this god-awful bill. I think we're better than that. And if we want to turn back these health care cuts, if we want to make sure we extend the Obamacare tax credits, if we want to make sure that our kids ought to go to school with the ability to have a lunch or a breakfast so they can learn better, if we want to reverse some of the dramatic cuts that are being made at the Department of Education as it gets disbanded, And if we're going to be willing to turn back what the Trump administration is already doing, trying to take to court the 5 school divisions in Northern Virginia and try to, frankly, steal the federal funding for those 5 school divisions, Loudoun, Fairfax, Prince William, Arlington, Alexandria, we got to rise up. I know in Virginia we say every year is the most important year. Well, this year's pretty important in terms of sending a message that Virginians are not going to abide by this Trump agenda. Next year is going to be even more important when we take back the House and maintain our Virginia blue seat and my seat in the Senate. And I tell you, if you want to make Hakeem Jeffries Speaker next year, the path to that speakership runs right through Virginia, where we have the chance to pick up 2 and maybe even 3 House seats. But it all starts this fall. If you, like me, am amazed at how much damage this Trump administration has done already in its first 8 months, think about how much more damage could be done if we don't reverse the trend, if we don't send a message this year in terms of our state races, and next year in terms of our steps to take back the Senate and take back the House and make Hakeem the Speaker of the House. The issues go on, but there's never been a more important time for us to all step up, speak out, vote. Please, this fall, take those extra friends to the polls. Please make sure and have those conversations with friends and family, and we all got them, that may have voted for Trump, and say, is this really what you wanted? Prices are still going up. Yeah, maybe you want the border secure, but that doesn't mean masked ICE agents picking up moms as they drop off kids for daycare, or picking up workers going to work on a daily basis. We are a better country than this. But if we don't turn out and vote, this move towards autocracy, this move away from rule of law, it will not be stopped. We are blessed to be Americans, but there is no God-given right that we're going to maintain that unique nature of our participatory democracy if we all don't get out and vote in record numbers. So to the Northern Virginia Black Caucus, for all of the folks who've been involved in tonight's event, I wish I could be with you. The stakes couldn't be higher. But if we do what we know best, particularly here in Northern Virginia, if we get out and vote, we win. Let's win this fall. Let's win next fall. Let's take back our country.
Now, you've heard from an impressive group of experts, but perhaps they haven't answered all of your questions. So our group has collected many of your questions, and I'm now going to present them to our panel. The first one is, please clarify specifically which parts of HR1 go into effect in 2026 and which go into effect after 2026. Is that best answered by Bobby or the supervisor?
So bill's huge, so I can't go through every provision. Some of them, plenty are immediate, plenty are later, right? So some of the Medicaid cuts, some of the SNAP cuts are immediate. The SNAP changes in work requirements are immediate, have already, are right away. Some of the student loan changes are immediate. Some of the student loan changes happen later. If you already have student loans, those happen later. If you're someone who has just taken out a new student loan in this new semester, that happens immediately. A lot of the Medicaid stuff, most of the Medicaid stuff is later, 2027. Some of the biggest SNAP changes, 2027, 2028, some 2029. Most of the tax changes are immediate. And in fact, if you are a corporation who's really good at time traveling, then you can get your retroactive stuff, right? Great, incentivize you to do something in the past too. So lots of the basically the answer is most of the tax changes are immediate and most of the spending is later, but some of the stuff is immediate. As I say, if you are taking out a new student loan like this semester, the new system applies to you, which will basically in a net present value, basically you will pay more over the long run when you account for kind of the time value of money. That stuff is all immediate. Some of these SNAP changes, the changes to kind of how the categorical grants work, you will be getting less money immediately. As I said, the changes to the work requirements, those are immediate. But the short answer is most of the spending cuts are later. That was a deliberate ploy where it happens, largely happening right after the election, so that they could maybe blame the incoming Democratic Congress for those cuts. Whereas some of the goodies they think they're getting, like some of these new tax cuts, which I should just say, not only do the tax cuts go to the rich, even the new tax cuts disproportionately go to the rich. It's a little less tilted, but it's still tilted to the rich. A lot of those things are immediate.
Yeah, I'll just provide some additional specifics. As mentioned, SNAP between 2026, 2027. Also, municipal bonds, which actually helps localities actually pay for road projects, things of that nature. We were able to kind of lobby to get that preserved, which is a good thing. But for things such as child care tax credit, that's been increased, but as mentioned, the biggest challenges will be SNAP and Medicaid, which you'll see kind of go into effect almost immediately within the next year. As he mentioned, student loans, going to have to pay very close attention to regulations around that, particularly certain programs under it. So if you are part or participating in the public loan student forgiveness program, major changes to that. And then also, I think as mentioned, just want to kind of clarify that the work requirements do phase in 2027 under Medicaid, and then the provider tax limits also phase in 2027 as well. Delegate.
I was just going to add in one other thing. So in the health insurance premium tax credit, so that expires December of 2025. So unless Congress acts between now and December, those are going to have an immediate impact with respect to health insurance premiums. Really glad that it was mentioned with respect to the tax changes, because that's going to be another big issue that Virginia is going to have to look at. And so this doesn't affect just things that we're going to have to spend money on in order to be able to make up the gap at the federal level, but it also has the potential to look at revenue loss to Virginia due to those tax changes. We actually put in a little bit of a barrier to help us out. So in Virginia last year, we paused our rolling conformity. So what we usually do is that you go ahead and conform with the federal level tax changes, realizing that it makes it a lot easier for people to do their taxes if we're both on the same page. We actually paused that last year, not knowing the order of magnitude of the cuts or the changes in tax policy coming up in 2026. And so we're going to have some really tough decisions that we're going to have to make because we don't want to lose a ton of revenue because that's going to impact our ability to backfill some of these important services. At the same time, we don't want to cause administrative headaches for people as they're trying to do their taxes. So that's going to be a particularly tough one to navigate. The person who's going to be at the front end of that is going to be Delegate Vivian Watts out of Annandale. She is the chair of our finance committee, and she is really great on these issues, but she's got her hands full.
I think the next question similarly will probably be answered best by the three of you. Please describe how the reporting requirements will affect Virginians.
Well, I'll just start with one note, and then maybe you all can provide some context. But particularly for the work requirements under Medicaid, that will impact individuals 18 to 64. They will be required to report at least 80 hours per month. And then there are additional Medicaid recipient reporting requirements as well, if you want to provide some additional context there.
That's right. Hi, sorry. As the supervisor says, yeah, so you basically, it's a requirement that you are working or doing a work-like thing half-time. There are exceptions if you are a full-time caretaker, and that can be including for, being for a kid or a sick parent or something. The issue with the work requirements, ostensibly they are lax enough to cover a lot of folks. As I said, already 92% of the people who are in their category ostensibly already hit it. the big issue with the work requirements is not per se how strict or lenient they are. It is all the paperwork that's going to come through in this. And so I think it's every 6 months they're forcing redetermination. So it's not just that there's tons of paperwork. There are lots and lots and lots and lots of opportunities to then mess everything up. And so that's, I think, the really, really tough thing about this is, oh my goodness, and as the delegate said, it costs a lot of money if you want to do it right, so you're spending a bunch of money, and if you shortchange it, all of a sudden, the only people losing out are your own citizens. So this is coming in, but as I said, the really difficult thing is that where we have seen work requirements or work reporting requirements in the past, it has just, even the people who are really kind of ostensibly doing everything right end up falling through the cracks. So I think, as I say, I would focus a little bit less on the specifics. Many people already hit them. The issue is that people are getting kicked off nonetheless.
Just kind of add on to that. I mean, these were very specifically designed to frustrate people and roll them off of healthcare and Medicaid. And so I think they've been pretty they like to say that, no, if you just play by the rules, but they are designed to frustrate, and I think the budget predictions exactly point that out. And I do want to say, this could also be called the Increased Paperwork Act of 2025. And it is going to really hit very hard, the people who administer our programs. And so whereas they were providing these services, we are now going to have to really totally redo our IT infrastructure systems, because it's not just SNAP, not just Medicaid. All of our systems are tagged with these. And so it's a Herculean effort. And then again, it just breaks my heart the amount of time that we're going to have people doing all this paperwork rather than actually delivering services that are meaningful and important to people. Anyways, that's a tragedy.
The next question maybe is calling for some bipartisanship, so I'm not certain if this question is really directed toward this panel. But anyway, are there any long-term benefits of the legislation for working families?
Perhaps I'll start, and I have some notes in front of me. For working families, that's a tough bit, but there were some things that I'm part of the National Association of Counties and the Virginia Association of Counties, and we were able to lobby to get a few things preserved, and so I'll just mention some of those. But again, kind of the core issues that I think are going to impact working families are not going to be in this particular bill. It really is going to rely on state and local to really take on the burden of individuals and families that were left out of this particular bill. But there are a few things just to be aware of. I mentioned about municipal bonds. We were able to get the tax exempt status preserved for that. There is a 1-year SNAP delay that the Senate was able to push through, again, between 26 and 27, but it's still going to be impactful, and people need to start preparing for that if they do accept Medicaid benefits currently. The low-income housing tax credit, kind of mentioned that. We were able to permanently get that increased to help provide for affordable housing in jurisdictions all across the country. And then, again, as I mentioned, the child tax credit, which was permanently increased. But again, those are very important. But when you talk about issues that are going to impact working families directly, those were left out of this bill purposefully. And so while you get a win here and there, the things that are going to impact your neighbors and your constituents, it's not going to be in this bill, unfortunately.
Just to add on this, so like if you were like, Bobby, please find something that you love about this bill. Back in the old, you have to go back to 2016, right? Because a lot of this was an extension of the old Trump tax cuts that he did in 2017. Back in the old day, we used to do personal exemptions. They got rid of the personal exemption, and they doubled the child tax credit. And if you were like upper middle class, you basically come out even. If you're a poor person, you come out ahead. If you're a rich person, you come out behind, just in this child tax credit. So that's actually a good thing. It was a progressive change. They switched from this deduction to a credit. The issue, right, if we're talking about long-term, is the personal exemption used to grow with inflation. Child tax credit is flat for forever. So over the long run, in the short run, this was a great, great, great change for poor families, right? This was an amazing, amazing change. But in the long run, it leaves people behind. So the analysis is like, well, what does this bill do for the average person? The average person probably comes out about $200 ahead from where they were. That's more than zero, but it's a lot less than something meaningful. And if you were to include the effect of like the Trump tariffs, right, you take the whole economy, then the average person is like maybe $2,000, $3,000 behind. And so it's not that there's nothing good in this bill, right? Like we could go through, we could say, oh, that one was a pretty neat change. Okay, that one was pretty okay. Well, maybe I didn't like that one so much, but that's better than nothing, I guess. I wouldn't have done it that way. There are a handful of small things in here. The issue is you have to compare them against the cuts inside of the bill and then the broad tariffs that have been imposed upon people. When you do that, when you include the whole package, it is quite literally only the top 1% that comes out ahead when you include the tariffs and the cuts and the tax increases relative to how you are experiencing it today in 2025. And that is the big issue.
I guess if I could just add one thought, a retort that I often get from my colleagues on the other side of the aisle is that it could have been worse, right? And so it gives me very cold comfort, but that is true because there are a couple areas where we were looking at even worse cuts or even worse policy choices, and Congress was able to tamp some of those down. And so you're looking at it in that perspective. And so if you're looking at that perspective, yeah, it could have been worse. It's still going to be extraordinarily damaging. From a bipartisan standpoint, though, and I can't speak for all Republicans, but I will say that at our meeting on Thursday, Delegate Terry Austin, who's from Botetourt County, he's the vice chair of the House Appropriations Committee, was pretty honest, and he said, yeah, we recognize these are really serious issues, these are really serious challenges, and that it's going to take all of us to be able to figure out what to do as Virginians. And so at least that was comforting to hear from him, that he acknowledges that these are really serious issues that are going to have an impact on Virginians.
So, Sam, we don't want you to feel completely left out of the discussion. This question has to deal with messaging. So in addition to the professional politicians, as a journalist, you might want to weigh in on this as well. The question is, the average voter does not equate loss of local hospitals with the big ugly bill. Likewise, they won't equate their loss of Medicaid subsidies under ACA or Medicaid with the bill. What can be done about this?
Yeah, so that's a really good point. I think we've come a long way from how things were in the past. In the past, people got their news from the local newspaper, or maybe local news, and this would be a big deal. Like, it'd be a big deal if a local hospital closed. I still think it makes the news, and I still think it's important. But to the point, they might not equate these things, partly because I think the media doesn't want to seem biased by just reporting the facts, and they also don't want to upset anyone. And so they'll say, this hospital is closing. Now, credit to the hospitals that were closing in the Shenandoah Valley. They actually said the reason we are closing is this bill. And so the media felt comfortable enough saying that because it was literally in the press release. But the media is not going to carry the water for communicating this. And I think that's up to Democrats. That's up to regular people. And frankly, the other side, the Republicans, don't want to talk about this. They don't want to talk about the facts. They don't always want to talk about reality. They want to talk about whatever they want to be talking about, whatever the shiny object is today. And I think it's a challenge for Democrats, but it's also the reality, and it's something that they have to work on going forward. And there's not going to be a magic bullet. But I think at the end of the day, we talked about the tariffs as well. I think the economy and kind of people's pocketbooks and personal issues are maybe a way to get around some of these issues, because you cannot spin your way around certain things. You know, the cost of living going up, or people getting off their health care. Maybe not everyone's going to make the connection, but if you get a few people to kind of, the light bulb goes off, you know, you don't always have to convince everyone. If you convince a few percentage of people, that'll be enough to win certain elections. So all I'm saying is, I get it. It's a serious problem, but you have to try, and I think there are ways to try to communicate and try to reach people.
Very quickly, I'm going to give the Republicans credit on something. They are brilliant when it comes to messaging. And the reason being is because they use fear tactics. Now, the difference now is we actually have a legitimate concern with regards to this bill. And so to a degree, as my good friend here mentioned earlier, we have to be really, really angry about this and really scream it at the top of our lungs. And it's legit. We're not lying about it. We're not just trying to appeal to fear senses. These are actual real things in this bill that will impact families, neighbors, and congregation members, constituents. And so Democrats have to learn to start screaming at the top of our lungs. I remember back to when ACA was looking to get passed, and the Republicans came up with these death panels, the messaging around death panels. It wasn't true, but they appealed to the fear senses of Americans. And so ACA barely passed, if you all remember. I mean, we got it passed, but it was barely passed because of the fear tactics used. And so we have to kind of get a sense of that, how to do that with regards to messaging, but not lie, right? Like the fear in this bill is actually real. And so we need to make sure that we're screaming it at the top of our lungs and that we're as angry as he said that we should be.
Next question. How will disability Social Security be affected by this bill?
Not at all. Oops, sorry. Not at all. There we go. Not at all. The rules of reconciliation say you can't mess with either old age or disability insurance. So fortunately, it won't be messed with here. Lots of regs the president can do to mess with DI, but just from HR1, no change. You can't change the money coming in. You can't change the benefits. Great news. Otherwise, they definitely would have tried. Every single Trump budget that he proposed called to do heavy damage to both DI and SSI. But fortunately, well, actually, as the delegate was saying, things could have been worse. We really thought that they were going to absolutely eviscerate SSI, and they didn't. So that was nice that they didn't do that. But yeah, they won't mess with DI. They didn't mess with DI in this. They want to do reconciliation round 2. They can't mess with DI in reconciliation round 2, 3, 5, whatever. They can't do it, which is great.
This may be a repeat, but could you please repeat the work requirements for Medicaid and SNAP under this ugly bill?
Okay, so for both of them, so SNAP already existed, used to exist 18 to 54, in the Fiscal Responsibility Act of 2023, they bumped it up to 60. This, they're bumping it up to 64. So gradually making it apply to more and more and more elderly people. One of the really nasty things that, the superintendent said, right, is, having to go up to 64, it means all sorts of folks who theoretically might ostensibly, my father-in-law retired at the age of 63. That someone like that all of a sudden is swept up in these work requirements. It's kind of one of the most nefarious things about it. So goes up to 64, newly imposed for Medicaid, existing but changed for SNAP. They bumped up kind of the existing, as I said, I mentioned in my kind of starting thing that there were exceptions for if the economy was bad enough. For SNAP, they put it at 10% unemployment, which tried to make the case that never happens ever unless the sky is falling. For Medicaid, they thought they should be a little bit nicer, so they did 8%, which ostensibly you see 8% sometimes, but in most economies you don't, in most recessions you don't see it, right? If we think back at the dot-com recession, right, 2001, we did not get up to 8% unemployment. Every single person who lost their job and that would have been swept up in these Medicaid work requirements. So for Medicaid, it was, as the superintendent said, it's 80 a week, or it's, basically, 80 a month. It's half time, right? I think they're doing it by 2 weeks, and so 40 for 2 weeks. But at any rate, it's 80 a month. This is, ostensibly you have to work half time, or it could be going to school, right? So they try to kind of make exceptions, and I think work training counts in that. So if you're doing some of the TANF work training or whatever, ostensibly they're doing all of those things. The big issue is not that there aren't exceptions, but that if anything goes wrong in getting this information to the state or in the state processing this information, then you are in big trouble. And as I said, one of the big issues, particularly for SNAP, was there was an understanding that if you had kids, we're going to make an exception for you, because we thought no matter, even if we think, I hate the term moocher, it's so bad, but even if we were using their term, there was an understanding that even if you were a moocher, your kid doesn't deserve to go hungry. And so what's new in this is they newly changed it to have it apply to people with kids 14 and older. So those are kind of these work reporting requirements. They existed for SNAP. They have now made them much more onerous. They didn't exist for Medicaid except in a few states. They used to be not allowed, but in the Trump first term administration, they granted waivers to allow some states to kind of opt into it, and then some of them obviously implemented it. And now it is a federal requirement. States are not allowed to not do it if they feel like it. And so we'll see what happens. Some states might try to make it really easy and allow people to not comply. Of course, that boosts, apparent error rates. One of the things the delegate said before for SNAP error rates, which, we were talking about the state cost share, but error rate, is a funky concept. So if SNAP overpays one person by one, or everyone by one, or half the people by 1%, and underpays the other half by 1%, you'd think that that nets out to a 0%, but they say, no, that's a 2% error rate. Right? If you check one box wrong, even though you are the right person and you're supposed to get it, that's considered part of the error rate. So all of these things are administered. Some states are going to make it easier. Some states, there might be lots of corporations that pop up, try to help people. We will see what happens, but it is a scary, unknown future that is transforming SNAP from Medicaid from a fundamental entitlement that you get because we believe in helping people get health insurance to something that is you maybe get unless something goes wrong.
We'll keep it moving along. Exactly how are the protected classes, the elderly and disabled, how are they going to be impacted by Medicaid cuts? And maybe we can combine this with this next question. And how is the bill going to impact soon to be retired and the retired individuals?
Ostensibly, if you are retired, it will not impact you in the work requirement aspect of it. The other things can start hitting you. So I mentioned in my one that they are impose mandatory cost sharing in states. States may not opt out of it. States go, make it easy. It's no more than $35 per procedure. It's no more than 5% of your income. So if Virginia wants to, they could say, oh, it's a $1 charge. Now, we know that even if you do a $1 charge, some people say, I'm just not going to do it, right? So it still has this nefarious effect of limiting use. But ostensibly, a state could go small. TBD, if we get a good governor, maybe we'll go small. If we get a bad governor, maybe we go really large. But that applies to any, lots and lots and lots of people, as the superintendent mentioned, are dual eligible Medicaid and Medicare, and any of those folks, because part of the issue is that Medicare, while amazing and a totally bedrock social safety net, doesn't do enough, right? Medicare Part A, B, and D just do not cover all the things that all the elderly folks need. So Medicaid comes in and supplements a lot of that. Now all of a sudden, the stuff that you need is going to cost you potentially a lot of money. So that's kind of the biggest stuff for SNAP. I think the biggest issue you're going to start seeing for the elderly folks is Delegate mentioned that they changed basically what you could do for the Thrifty Food Plan. Joe Biden, one of the best things maybe the best thing he did was he did a reevaluation of the Thrifty Food Plan to unilaterally increase SNAP benefits by 25%. Awesome. They went from a meager $1.60 per person per meal on average to $2 per person per meal on average. Big spending, still only $2 per person. And the Republicans looked at that and said, never again. Over my dead body will we help people in this way again. And so they made it so you just can't do that anymore, which means that it kind of over time gets more and more and more out of whack. So that's kind of one of the things that over time, it won't be able to keep up with changing nutrition standards and that sort of stuff. That's something that's going to harm everyone, including the elderly. And as I said, they change, right? You're supposed to be able to write off your internet costs or whatever because that's considered a basic necessity. And they said, what? Poor people having internet? Well, that's too much, and they probably shouldn't have a microwave either. So now you can't write that off either. And so now all of a sudden you get less money because you're considered having more income because you pay for internet. So there are a whole bunch of things that basically are just going to strip away and pinch pennies away from elderly folks on SNAP. Not kicked off, but pinching away.
It may be worth just kind of talking about like what state and locals may look to do to try and help those that may be negatively impacted. I'll just say, obviously, we're keeping our eye on kind of what these cuts actually materialize to look like and how many constituents within our counties and within our representation area may be impacted. I know in Prince William, again, we are trying to be as conservative as possible with our budgeting in anticipation for the worst absolute scenario. With regards to kind of the cost sharing discussion and putting the onus on the state, I know that particularly during COVID, we set up our own housing assistance program, right? And so we may look to do certain things like that, like increasing food assistance resources to those in the county that currently provides it. We may set up certain programs to help those impacted by federal job loss. With regards to Medicare and Medicaid, our senior population, we may set up a program to help those within a certain age bracket that just needs a little bit of help transitioning from federal support to private support. So those are the types of things that I know that the county is looking at, and we'll wait on the state and get direction from the state on what additional resources we need. But again, all of this will cost money. And I think my biggest fear is, at least in the county, we've been trying to reduce taxes over the past several years with an increase in our commercial tax base. Well, this may force us to do the opposite, because we do have to pay for these programs. And while we were used to getting state and federal support, we realized that with the transition, we're probably going to be on our own with having to fund some of these new programs to help those impacted by federal cuts. I'm not sure if you want to add anything.
I guess I'll just add, we're fortunate in Virginia, and I think largely because of Democratic leadership, that we have a relatively structurally sound budget. And so that's good compared to a lot of other states where they're already dealing with a deficit, and we're very proud of that. I will tell you, though, is that a lot of what our savings is, it's for one-time costs, right? And so the governor went ahead and vetoed about $900 million worth of programs out of the last budget. So it gives us a little bit of a cushion. But one of the most important things that we know as appropriators is that you can't use one-time savings for long-term costs. And so those are going to get eaten up really quickly, when you hear us talking about $90 million here, $250 million here, and so on and so forth. So we really do have our work cut out for us. I do think that there is a lot of room for, again, those partnerships with respect to our localities and the state in terms of how we navigate this. One of the tragedies of that $900 million worth of cuts that the governor made is that we actually started that process. And so one of the things that the governor vetoed was money to start local housing trust funds to do exactly what we need to do in order to support those who are put into bad housing situations that are facing potential eviction. So again, I think the housing area is going to be really, really important for us. Unemployment insurance is going to be really important for us. And then working very closely with our localities in terms of how do we pivot, how do we make our economy more resilient in the long term, are all going to be things that we're going to be working on in 2026 and beyond.
I believe you just answered this question, so I'll repeat the question only to ask if there's anything else you want to contribute to it, and if not, we'll just move on to the next one. What can Virginians do to insulate Virginians against HR1? Is there a way?
Again, I think kind of getting to your three pillars issue, which is, do what we need to do in order to be able to keep what SNAP benefits we have out there. Make sure, that our unemployment benefits are adequate, or at least get us somewhere along the line in order to being able to make ends meet, and then ensure that people who are suffering, short-term loss of income, particularly vulnerable younger families and younger populations, that we are giving them a chance to be able to keep that roof over their head, or at least transition them gracefully to affordable or housing that they can afford.
Maybe worth noting, I think Fairfax and Loudoun, particularly on the the affordability piece, already had kind of a housing assistance program in place. Prince William is just now catching up, and so I would love to say that we had the foresight of what was going to happen, but the reality is we were just trying to catch up. So now we have an affordable housing ordinance that we just passed. It was coupled with a housing assistance program, and now I'm working on an actual housing assistance program to help those with immediate housing needs. So I thought it was important that you mentioned about housing assistance, because I know a lot of people with the federal cuts are now looking at how do I pay the bills while I transition into, well, we have these programs now that will help us, again, help other individuals.
I'm going to make this our last question. I said we do as many as we could as time permits, and so this will have to be the final one. And we're just going to combine the two. Can a new Democratic Congress stop the implementation of HR1 that starts in 26-27? Are there any opportunities to repeal provisions of the bill?
So, as Sam said, reconciliation is a special process. What's special is you can get around the filibuster in the House. You pass anything with the majority, in the Senate it takes 60, unless you're doing one of these special things. Anything that can happen through reconciliation can be undone through reconciliation. So a trifecta can undo any part of this. But we cannot change president in 2026. So even if Democrats are swept into Congress, they can pass a bill through Congress to undo any of this, all of this, but it will not be signed into law. And so if Democrats ended up with a super majority in 67 in the Senate, it's ostensibly possible, but that is not going to happen. We'll be lucky to see 50 Democratic senators, 51 Democratic senators, so we'll be lucky to see majority. So there is realistically nothing you can do to undo this on a purely partisan basis. I think Republicans understand that there are some parts of this that they don't like, and so there's opportunity to be very smart and clever and push to undo some of the stuff that, if we are advocating, if we continue to talk to continue to advocate for some of the worst and kind of most easy to message stuff to be repealed, I think there's very, 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 very real room to have it done. And then, of course, 2029 is a real time a lot of this will come into effect, but that is better late than never, because because the people will still be hurting and will be hurting more and more as more things come online.
Sorry, if I could just add to that, because just to go back to what we talked about at the beginning. So 2024, President Trump won largely, I would say, for a lot of voters in the middle on the economy, cost of living, particularly voters who may have previously voted for the Democrats this election decided to vote for President Trump. I think it's a real opportunity for Democrats if they can shift the messaging partly on this, partly on tariffs, because people, every time someone wins an election, they think my theory of the world is correct and everyone loves my theory of the world. And that's what we saw for the last 6-9 months, that the Republicans, everyone in America agrees with them. That's not true. I think a lot of people are uncomfortable with what's going on. And the economic issue, the healthcare issue, these types of things where Democrats traditionally have been well on, people want the Democratic Party to focus on working people, on trying to get people the things they need. And so I think there is an opportunity in the midst of all of this. And as the other people have mentioned, I think there is an ability to change some of this in the future. And this is not necessarily going to be the rest of time. And so that's just something to keep in mind, that while right now there's going to be some damage in the short term, in the medium, long term, there are also opportunities to undo a lot of this.
Yeah, and if I could just add in there, because I agree it's going to be tough to, in the short term, reverse some of the damage done by the reconciliation bill. One of the things that we do need to really focus on, again, is that it's not just the reconciliation bill. We've got ongoing processes that are equally as problematic. And so with the federal fiscal year 26 budget appropriations process going on, one of the areas that we're looking at very, very closely as a state, and I know our local school boards are looking at, is the difference between the House and the Senate positions on K through 12 education. And so for the House side, these were scary statistics, but these are what we're dealing with. So about a 27% cut, or $9.9 billion in overall K through 12 support. 34% reduction, or $4.7 billion impact to Title I schools. So our very most vulnerable schools that need the support the most, that would be a 1/3 cut in their funding. And then proposals to eliminate programs for homeless students, migrant students, adult education and literacy, English language acquisition, and other key areas. On the Senate side, they don't have those cuts in there. And so this is a case where we can root for the Senate and be thankful that we've got that 60 vote threshold in there. But these are the kind of things that we can impact in the short term and make sure that those don't pass.
Thing as we end, don't underestimate the importance of lawsuits. We've seen a few lawsuits here and there with regards to, well, actually a lot of lawsuits with regards to the current Trump administration. But even when I go back to ACA again, even when ACA was passed, a lot of conservative groups sued the Obama administration for various provisions of the ACA. So the same can happen whether it's successful or not. But don't underestimate the importance of lawsuits.
That will have to be our final question. So let's give a round of applause to our fantastic panel. Before we conclude today's community forum, I want to thank everyone involved in making this forum a success. Again, I must thank the panelists. I also want to thank Senator Salim. I want to thank Representative McClellan and Senator Warner for their contributions, and thank you to the organizing committee from the Northern Virginia Democratic Black Caucus. That's Alpha, that's Paul, Dee, Bo, Meredith, Christian. I thank you all. And of course, I must extend my deepest and warmest gratitude to the First Baptist Church, Stacy Say, and Dr. Vernon C. Walton. Before I ask Pastor Walton to wrap things up with a benediction, I want to exercise the moderator's prerogative to offer a few remarks. As the events of the past week, indeed the past several months, have made abundantly clear, we are living through perilous times in this country. As we attempt to navigate these troubled waters, it is tempting for many of us to withdraw, throw up our hands, and give up, believing that there is nothing we can do to change things, to make anything any better. While that belief is tempting, I believe we must reject it. We must recall that we as a nation have encountered difficult times in the past, and we have overcome great trials and tribulations in our history. African Americans must recall our history and summon the strength and courage of our ancestors during these times. If they could overcome slavery and Jim Crow, how can we just give up? If they could sit at lunch counters knowing that they would be beaten and arrested, how can we, in good conscience, fail to find the time, when called upon, to do far less? Americans rallied to fight for women's rights and the rights of labor, improve our environment, and win fair treatment for persons with disabilities. How can we now cower in the face of nasty tweets? We do have agency. If we want to maintain our civil rights, the ability to tell accurate stories in schools and museums, our right to free and fair elections, then we, all of us, must do what we can, wherever we can, whenever we can, like many who came before us. If we do, no matter how long it takes, we will prevail. Dr. Walton, please offer your final words of prayer.
Again, let me thank you for allowing us to partner with you to host this event, and certainly thank each of you for coming. Again, a great round of applause to our speakers for sharing your insights. I do again want to formally recognize Delegate Karen Keys-Gamarra, who came in during the program. It was always good to see her, to have her in our midst. And I want to just add, thank you so much, as you've reminded us in your final remarks. We do have agency, and we do have power. And I want to encourage the Black Caucus. I want to encourage all of our elected officials and the other organizations and institutions that are represented here today. When you do look at our history and you read the timelines and the journey of the road that we have traveled, no one institution has made progress by his or herself. It has been a partnership. It has been a combination of the faith community. It's been a partnership of faith and labor and faith, labor, and elected officials working together. And so I would ask that even beyond this particular moment, from the caucus and even from our elected officials, we've heard a lot of the statistics today, and we've heard a lot of information relative to the bill. But I think it's always important to share some how-tos. And so as a faith leader, and I talk to faith leaders all the time, and it's not that faith leaders don't want to be engaged, but very often, as I said in my opening remarks, we need interpreters and a roadmap. And so I think a coordinated effort to galvanize and to create that worksheet, that how-to sheet, and a real legitimate partnership between all of these entities will take us a very, very long way. And so I commit myself and offer myself, and certainly seeing Pastor Stephen Cobbs with us today, I'm sure we've been in the trench together a long time. He would be open to that as well. And so we offer ourselves to you in that regard. And having said that, I'm going to ask my brother, Pastor Stephen, to come and to offer the final benediction.
My brother Vernon is always so good about providing notice. Another way of saying I got none. But I don't ever come empty-handed, particularly when I come to Vernon's house of worship. Let us pray. Gracious God, we know that you have called us to be people of faith, to be people of hope, to be people who are connected. We live in perilous times. These are not times that call for optimism, for a feeling that things are just going to work out. They are times that call for hope. Hope that realizes indeed we do have agency, and that hope is in our capacity to make good things happen together. Lead us in doing just that together. Bring us all together, people of faith, people of no faith, people of hope. This we ask in your holy name. Amen.
Thank you both. That concludes today's community forum, but please look out for future events by the Northern Virginia Democratic Black Caucus, and have a great day.